Hello, my name's Sarah Caney and I'm a UK-based specialist in feline medicine. In this short webinar, I'm going to be talking about a condition called chronic kidney disease. Chronic kidney disease is one of the most common conditions that we diagnose in our clinics, and unfortunately, as you can see from this slide, is especially common in our older cats. To be defined as a chronic condition means that it has to have been present for several weeks or longer, because the word chronic means long term. And the kidneys are required for many important tasks in the body. A cat with CKD has kidneys that are no longer able to do these as well as they should. The sorts of things that normal healthy kidneys do are listed on this slide. So for example, they're responsible for excreting waste products from the body into the urine, but also kidneys are very important in maintaining normal blood levels of salts, acid, normal hydration levels, normal blood pressure, and also in producing and activating some hormones. So they're very complex organs. A cat with CKD may appear, particularly in the early stages, to be completely healthy, and this is often an illness that develops quite gradually over a period of time. Once your cat does develop clinical signs, then these tend to be most commonly an increased thirst and weight loss, often in association with a reduced or variable appetite. Many cats with CKD will also suffer from nausea and vomiting, and are often reported by their carers to be lethargic or depressed, generally under the weather. To make a diagnosis of CKD, then we need to analyse both blood and urine samples. Urine samples can be collected with your cat at home or via a procedure called cystocentesis, where a needle is inserted through the body wall into the bladder, as shown in the top picture here. The tests that we're very interested in from a urine perspective are particularly the concentration of the urine, and we assess concentration using a refractometer. We're looking at a measurement called the urine-specific gravity, and if a cat has CKD, they are less able to produce concentrated urine, so the urine-specific gravity drops. The urine becomes more dilute or more watery. From a blood test perspective, we're very interested in looking at levels of substances which are normally excreted by the kidneys, and so typically that means blood urea and creatinine levels. Creatinine levels are especially helpful. More recently, we've had a newer test available which is called the IDEX SDMA assay, and this can also be very helpful in identifying cats with kidney disease. Because the clinical signs of kidney disease often don't develop until the disease is quite advanced, and because cats are very good at hiding signs of illness, I would really encourage you to attend any invitations to your clinic for routine health checks so that your vets can assess how your cat is doing in general. In particular, for example, weight loss can be a very useful, even though non-specific, indication of illness such as CKD. And the earlier we're able to diagnose this condition, the better chance we have of a successful treatment outcome. Every patient is different in their needs when it comes to treatment, and for this disease in particular, it's going to be something that you'll need to manage for the rest of the cat's life. Unfortunately, CKD is a progressive illness. It will get worse with time. And all patients are different in terms of their particular priorities, so I really encourage you to work closely with your vet clinic to really work out what are the key treatments for your cat, what's going to work best for your particular situation. There are some general principles when it comes to management of CKD. And the most proven treatment is actually feeding a special therapeutic kidney diet to your cat. And there are numerous publications that have shown that if you have a cat with CKD and it will eat this specially designed therapeutic renal diet, it will live much longer and have a much better quality of life. So I would really encourage you to follow your vet's advice when it comes to diet. Do your best to transition your cat onto that diet because it will do much better. But in any individual, there are also other treatments that can be extremely helpful in terms of supporting quality of life. So, for example, appetite stimulants, treatments for nausea and vomiting, treatments for high blood pressure, etc., can all make a massive difference to the cat's quality of life. I'm very happy to say also that because of advances in our understanding of this disease and also our ability to treat this disease, cats diagnosed with CKD nowadays generally do extremely well, usually living for several years following their diagnosis with a very good quality of life. So this is a disease that I would really encourage you to do your best to treat with your cat. Of course, following the advice from your vet. Some cats, unfortunately, will be diagnosed when in the very terminal stages, and treatment may be less of an option for those. For more information on CKD, please consult my website, vetprofessionals.com, where you can find under the shop menu, firstly, my book, Caring for a Cat with Chronic Kidney Disease, which may be of interest. Also, access to a longer webinar on CKD, which I've recorded for carers. Under the helpful info menu, you can see my free downloads, a number of documents which you can access, which provide technical information on, for example, how to encourage your cat with CKD to drink more so that it maintains its hydration as well as possible, how to collect a urine sample from your cat. There's also a useful links section where I recommend other websites that I think you might find helpful. And I do also offer a telephone referral service for cat owners interested in finding specialist advice and information for their cat in its particular situation. So I hope that's been a useful brief resume of this very complex condition, and I hope you'll consider accessing these resources as well. Thank you very much for listening.